What attracted me to UNLV, School of Dental Medicine, was I grew up here in Vegas. I went to high school here, I graduated, went to UNLV undergrad on the Millennium Scholarship, and it was just a natural transition to go to higher education and come to the School of Dental Medicine. The actual faculty to student ratio here gives us a lot more one-on-one training with our faculty. Our faculty are open at all hours, as opposed to a larger university where we don't get that one-on-one interaction.
UNLV was my top choice of school, being that I was born and raised in Las Vegas. I have my entire family here. It gave me an opportunity to stay close to home and be familiar with my surroundings. And also, UNLV is very advanced as far as materials and technology, and that was really appealing for me as a student.
I always knew I wanted to come here. Being born and raised here in Vegas, I knew this is somewhere I wanted to stay. I wanted to stay where I was raised, give back to my community, and watch the city grow even more than I've already seen it grow.
I moved to the state of Nevada just before high school, and I attended all of high school and college here in Nevada. And I felt like I had become a part of the Nevada community, and I wanted to stay in the state for any more education that I pursued. We serve probably several hundred patients every single day here at the school in our clinics with our predoctoral students. These are patients who may have difficulty finding dentistry on the outside in the private practice world, because as we all know, dentistry can become very expensive, and the dental school provides them a means to have quality dental care done at much less expensive rates.
Without the School of Dental Medicine here, I would not have any dental care. It's been 14 years since I had my last dentures. There's no way possible that I could have afforded dentures. I'm going to be 70 years old. I'm on Social Security, and as such, there is no dental benefits for us. Everything has to be paid out of our pocket, and it was cost effective for me. I feel comfortable. That's my main thing. I feel comfortable, and they tell me every step of the way what's going to happen.
Being a patient here has, for me personally, increased my, I guess, self-esteem to know that 4 or 5 years from now, I'm not going to lose my teeth. I'm able to take care of myself even though I don't have the insurance that other people have, and it's affordable.
The care here at UNLV School of Dental Medicine has been outstanding. To be perfectly honest with you, I probably will never go to another dentist because I think they lose that compassion that they need to have. Being a patient here at the dental school has really meant a lot to not only me but to my husband, because I'm finally, after 20 years, able to get some partials put in so that I could eat real food like everybody else. I don't know how I sound, but this is the first time, like I said, in a long time that I've had teeth.
The general student population gets to do above and beyond what a normal dental school would do. We get further training and get to outreach and help more patients because of that.
There's a huge need for the school to be here in this community. There's so many people that have yet to seek dental care, and given the economic crisis that everybody's facing, the nation, it's extremely important that there's a school here that can offer good quality care at reduced fees.
I was attracted to this school because I am a Nevada resident. It made more sense. I was close to home, and I could serve the people in the communities that I live in. My family is all from rural Nevada. I have family in Eureka, in Ely, Austin, Winnemucca, Lovelock, all these little small towns, and it just appealed to me to stay within the state.
One of the defining experiences I've had here at the School of Dental Medicine was one weekend on a Saturday clinic at Give a Kid a Smile Day, where we had students from the community come in, children from the community come in and have the students work on them. But what also happened was dentists from the community also came in and helped on this one-day event. And I saw firsthand the need and how many children out there need access to dentistry, and what the school is doing to help with this access issue and providing care actually free of charge for these students. And whatever wasn't taken care of that day, these dentists in the community were going to finish their care. So that just showed me that the dentistry as a whole, the compassion and integrity and actual care for the community that the profession as a whole has, kind of just embodied in that whole Give a Kid a Smile Day.
The Saturday morning children's clinic was started by a couple of my classmates, and we bring in children who otherwise couldn't afford health care. In the last year and a half, we provided over $100,000 in free dental care to these kids who have been referred to us.
My name is John Farron. I'm a student here at the UNLV School of Dental Medicine. I am the founder of the UNLV Sergeant Clint Farron Memorial Clinic. The name has come about from my brother, who was killed in Baghdad, Iraq in March of 2004. In memory of him and those like him who neglect their oral health for their mission, for what they do in the service, we've started this clinic to treat them. We serve National Guard soldiers who are non-deployable status, and we serve other veterans from previous wars. We have done over $20,000 worth of treatment for just under 60 patients. This year we plan on doing a significant amount more than that. This is going to be a nationwide endeavor. We are going to be providing a template for other dental schools to follow our lead in serving our veterans. This is going to be a life-changing experience both for the students, faculty, and patients.
I saw in the profession of dentistry, you get to build a one-on-one relationship with your patients. You get to interact with them, become part of their family, and help them in more ways than just oral health needs.
I think that by impacting patients, oral health, that we'll see a reduction in everything, including, overall health and insurance and all the fees that come along with somebody being sick.
I think that the dental school is doing a tremendous amount for the community.
Just having the faculty that we have here at UNLV, I feel that the opportunity that I've been given is something I need to take advantage of.
It allows me to give back to the community and give back to the people of the state and of Las Vegas, and provide a service that I feel good about. At the end of the day, I can go home and be happy about what I did and know that I helped someone.
You have a lot to offer, and a lot of people just don't know that it's here.
I recommend this school to everybody, people I work with, my family in different states. I just can't say enough about it. I'm very, very happy.
It's easy for us to throw up the statistics and the numbers of how many patients that we are treating and helping here in this community. But it's important to remember that there's a name and a face that go along with each one of those numbers. That as we treat these patients and see these people, that we are making a difference in their lives. There's a certain amount of joy and satisfaction that you get from your profession every day that you go when you see a child being taken out of pain. Dentistry is more than just filling teeth. dentistry impacts the lives of our patients. We see the joy and satisfaction in their lives, and it carries over into our lives.